Normal delivery versus cesarean section. Actually, currently, many women are opting to go for cesarean section for their own personal reasons. Given a chance, which one would you choose? Which is the best amongst all these? Welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here, I'm going to talk about normal delivery versus cesarean section. I'll share the benefits, the disadvantages of each and every method, and the indications of different types of cesarean section. Stay tuned. The goal of any delivery is to have a healthy baby and a healthy mother. This is the most wanted outcome in any delivery. And again, when I say normal delivery, I don't mean that having cesarean section is abnormal delivery. The normal delivery, it's only that it's going the natural way through the birth canal, that is the vagina. You are having your normal delivery, you are giving birth the natural way through vagina. While cesarean section is making an incision on your abdomen into your uterus to deliver the baby. That is the only difference. None of them is abnormal and none of them is bad. They are both helpful in different situations. Let's start with cesarean section. Cesarean section, we have different types of cesarean section. Actually, the commonly used term is CS. So when I say CS, just know that I mean cesarean section. We have elective CS and emergency CS. In elective CS is whereby the doctor plans together with the mother a later date. There is a schedule that the mother will come on this certain day. And we have an emergency CS whereby the mother was progressing well, but something happened along the way that needs an emergency action. So this mother has to be rushed for an emergency cesarean section. What conditions can lead to having a planned cesarean section, the elective cesarean section? Number one, if you have something that we call low-lying placenta. Naturally or normally, the placenta is supposed to be on the upper layers of the uterine fundus. But again, if it is on the lower side of the uterine fundus, this means that there is high chances of bleeding during labor because it can actually detach before even the baby is born. The second reason is when the baby is too big to pass through your birth canal. This is what we call cephalopelvic disproportion. And another good reason is when you have what we call malposition or even malpresentation. The baby is either bridge, bro, transverse, any position that does not allow you to have vaginal delivery. Another condition where you can have elective CS is when you have infections like genital herpes. Actually, if you give birth with this kind of infections, then there is high chances of transmitting this infection to the baby. Previous uterine surgeries, maybe you had fibroids or any other condition that really landed you to have uterine surgeries. These two will lead you to have an elective cesarean section. And lastly, if you've had 2 or more previous cesarean section, then in your subsequent pregnancy, there is high chances of you having elective cesarean section. And now let's move to emergency cesarean section. Actually, just as I already told you that in an emergency cesarean section, you had the intention of giving birth vaginally, but again, something happened along the way that really requires an immediate emergency action. The first one is what we call fetal distress. Fetal distress is whereby your baby is not now getting enough oxygen, or there is something that is really, really wrong with your baby. This will be shown whereby the heartbeat of the baby is either decelerating or either accelerating above normal. Another thing you'll realize when your baby pulls inside your uterus. In this, we'll see something like meconium stained. The liquor that will be draining will be either greenish or even dark. This is an indication for you to go for an emergency cesarean section. It only shows that the baby is in distress. Another good reason why you will end up in theater is when the labor is not progressing well. We call it non-progressing labor. And again, you've been laboring like some hours back, but the baby's head is not descending effectively, or the contractions have just decided to stop. Or again, you are having contractions, but You are not really dilating effectively compared to whatever you are undergoing. This too will lend you to theater. Another reason why you will land into theater while you are just laboring normally is when you suddenly started bleeding, and the bleeding can be heavy. This can be an indication that the placenta has detached itself from the wall. Yeah. Conditions like eclampsia needs an emergency cesarean section to save the life of both the mother and the baby if possible. And lastly, conditions like cord prolapse, that is whereby the cord slips outside the vagina while the baby is still inside. There is high chances of spasm, and this can deprive the oxygen going to the baby. So an immediate and emergency cesarean section must be performed. The benefits of cesarean section is that it's a life-saving in all those conditions that I've mentioned previously. There are indications, like in an emergency CS. And again, it is more safer compared to having vaginal delivery if at all the mother has some conditions like the preeclampsia and all that. And again, another importance or benefit of cesarean section is that it's more convenient for the mother to plan. You can even plan with the birthday of your own kid. It's scheduled. I mean, you can really plan for it compared to this other one that will come any other day, any other time. Those are the benefits of having cesarean section. Now let's move to the disadvantages of having cesarean section. Number one is that you will stay in the hospital a little bit longer compared to having vaginal delivery. The second one is that the recovery period is always longer in cesarean section compared to the vaginal delivery. Actually, you will cover like up to 2 months. You're still there feeling so much in pain. It's also expensive, yeah. In some other hospitals, if it's not a government hospital, like currently in Kenya, almost all these government hospitals is doing it through the Linda Mama program. But again, if you walk yourself into those private hospitals and you want a cesarean section, actually you will pay a lot of money. Another disadvantage of cesarean section is that the pain on the incision site, yeah. Remember your abdominal layers up to the uterus, there was an incision. So for you, the pain is much more compared to someone who had vaginal delivery. And lastly, having cesarean section, the death rate or complications is 5 times higher compared to having vaginal delivery. The complications of sepsis or infection, bleeding, embolism, you can have amniotic embolism or even thromboembolism. The complications are 5 times higher compared to someone who had vaginal delivery. And now let's move to the vaginal delivery. This is just the natural process of giving birth through the birth canal, passing of the baby through the vagina. Yeah. Let's see the advantages of having vaginal delivery. Number one is that you will stay in hospital a little shorter period. Actually, the observation period is roughly 12 to 24 hours. Then the mother is discharged together with the baby if at all everything was in a normal condition. There is less chances of bleeding compared to cesarean section. The recovery process is always shorter compared to the cesarean section. There is also immediate bonding because after delivery, your baby will be put on your abdomen, and again, quick initiation of breastfeeding. Vaginal delivery removes fluids from the lungs of the baby. Actually, while the baby is passing through the birth canal, trying to squeeze itself out, the fluid from the lungs is also removed through the nostrils and the mouth. This is not possible in the cesarean section. The baby also acquires some good immunity as it goes through the birth canal. Actually, in the vagina, there is some healthy bacteria that when the baby comes into contact with, will start building its own immunity. Now let's see the risk or disadvantages of having vaginal birth. Number one is pain, actually labor pains. It's tedious, it's demanding, the process is long, yeah. You can imagine laboring for like 20 hours compared to cesarean section, which is just a short period and you are out with your baby. But again, the after pains in cesarean section compared to the after pains in normal delivery, it all depends on you. Having vaginal birth can also risk you to have tears internal injuries. This is where the fistulas can come in. But again, these two can be corrected by monitoring and episiotomies. Having vaginal delivery too can lead to possible weakening of the groin muscles. So you really need to keep up with your Kegel exercises. The risk of stress incontinence, bowel, and urine control complications can arise from having vaginal birth. And lastly, comparing the advantages and disadvantages of these two different modes of delivery. Vaginal delivery has a fewer risk to both the mother and the baby compared to having cesarean section. But again, the end result of any delivery is to have a healthy baby and a healthy mother. Any condition that compromises the life of either the baby or the mother, then an action should be taken. Should it be the cesarean section, it's the best choice for that situation. Thank you for watching. Bye, and let's meet in my next video.